Hello, everyone, and welcome to our All Things Greyt webinar. My name is Mandy Albert, and I am the President and Executive Director of the Greyhound Health Initiative. Today, Dr. Guillermo Couto will be talking about the unique medical challenges that greyhounds or other sighthounds face. Our goal is to educate both owners and veterinary staff to ensure our sighthounds get proper medical treatment when in need. Here is our agenda for today. Please type any questions you have in the Q&A, and they will be answered at the end of the webinar. Please use the chat function for any technical issues you are having with Zoom, and we will do our best to help you troubleshoot them. For those of you who are not aware, the Greyhound Health Initiative is a nonprofit organization that is committed to improving the health and well-being of sighthounds around the world. We build awareness of their unusual medical characteristics within the veterinary and adoption communities through our education, outreach, and research programs. This webinar is part of those programs. If you would like further information on our educational resources, please visit our website, ghi.vet, and click on Educational Resources. You can filter the options to the specific resource you are interested in, and then browse through the articles and videos. You can also follow us on Facebook and Instagram for the latest educational information and/or future events. Now it is my pleasure to introduce to you Dr. Guillermo Couto. Dr. Couto is a board-certified veterinary oncologist and internist with an interest in hematology and sighthound medicine. He provides consultation through his company, Couto Vet Consultants, on veterinary and comparative oncology, hematology, and immunology, and clinical consultation on greyhound and sighthound medicine. He also delivers high-quality education for owners and veterinarians. Dr. Couto has worked with greyhounds and other sighthounds for over 3 decades. He's had an accomplished 30-year teaching career at The Ohio State University and is a pioneer and expert in greyhound and sighthound medicine. In 2004, Dr. Couto launched the OSU Greyhound Health and Wellness Program, creating an outreach and teaching effort that incorporated basic elements of shelter medicine. Once retiring from the oncology hematology service at the Veterinary Medical Center at OSU, he helped establish the Greyhound Health Initiative and the GHI Blood Bank. Since then, Dr. Couto has been actively involved and dedicated to improving the health of sighthounds through education and clinical research. Now I will pass it over to you, Dr. Couto.
Thank you so much, Mandy. So I think that I think you need to stop sharing. There you go. Great. So I will now share my screen and we'll get the show on the road. So hopefully everybody can see the screen, and now I'm going to be able to project. So great to be here. So thanks, Mandy and Joe, for organizing this and for taking care of getting all these people to sign on. This is awesome. So the challenge today is to talk about greyhounds in only 50 minutes. Most of you who know me know that I really like to talk about this for quite a bit. And the second challenge is that we have owners, adopters, family members, trainers, we have veterinarians, we have veterinary students. So I'm going to try to shoot for the middle ground, and there will be some technical info, but I will actually be using some pretty common terminology. So I assume most everybody will understand what is going on. The other title I could have used for this webinar is, as I always like to joke, are greyhounds really dogs? You know, and sometimes people go, of course they are dogs. I go, well, they kind of look like dogs, but they're not exactly your run-of-the-mill dog. So what I'm going to do today is talk a little bit about what is different in greyhounds, and then we were chatting with Mandy and Joe. We will have another webinar later in the year where we will talk about specific greyhound diseases, and I'll bring that up here in a little bit. As Mandy was saying, you know, the Greyhound Health Initiative took care of organizing all this. So I think that we all thank them for what they do, and I'm glad to be a part of it. So first disclaimer, you know, I'm not a greyhound specialist. You know, I'm just a greyhound aficionado, and I just like greyhounds and sighthounds, and I'll give you a little bit of that history here in a second. But as Mandy said, I'm a board-certified internist and oncologist. I am not a pathologist, and I am a consultant with IDEXX Laboratories. So those are the only disclaimers. So I'm going to do a short intro, talk a little bit about sighthounds, and we could spend days talking about sighthounds, but I'm going to bring up some issues about greyhound physiology, and then I actually put diseases in quotes because what a lot of people think are diseases in greyhounds are actually normal physiology. So we'll go a little bit over that, and then I'll talk a little bit about results of lab work, what we veterinarians refer to as clinical pathology. So here's what happened to me a long time ago. In 1990, I adopted this dude over here, Clyde, that came out of a wheeling racetrack. And then we ended up adopting Raider, who you can see here, who was a pup. And these two little dudes, Jason and Kristen, are our kids. And why did I make a big mistake? Because, when I did my first physical exam, I went like, this dude is really different from other dogs. And then I started trying to figure out, what is different. And then we spend a long time trying to figure out why are they different and what can we do about it. And these two little kids grew up, and you see them there working at the Scooby Medina shelter. We used to go to Spain to work in a galgo shelter several times a year, and the kids were part of a trip. And if you fast forward, these two dudes are now board certified oncologists, and of course they kind of like greyhound, so it's part of the DNA. So I always say that if I had adopted a lab instead of a greyhound, I would have had a lot of time to do other things. And, during my time at Ohio State, and actually even since I left, this particular paper is since I left, we generated 43 peer-reviewed publications on a greyhound or sighthound medicine. And again, we don't do research with dogs, but we do research that provides information about dogs. I always use the Wikipedia example because remember, everybody uses Wikipedia and you need to vet whether what you're reading is real or not. So it's a little bit of a trick. But all of you guys know what sighthounds are. They're dogs that pursue prey, keeping it inside, blah, 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 blah. And again, we know that sighthounds have existed for at least 5,000 years or longer. And there is a lot of stuff going on now on genetics that is really, really exciting, and I'm going to share a little bit of that with you in a second. But why are they called sighthounds? Keep an eye on this area here, and you will see that that rabbit should not have been there at that particular time because the greyhound said, well, that dude is mine, and I'm just going to go after it. And all of you know how fast these guys can move, and a lot of people say, if you look at a greyhound, it's kind of like a hybrid between a dog and a cat, but actually it's not. This is what you get if you cross a dog with a cat, if you could actually do that. So I always jokingly say that if you want to make a greyhound, you need to get your good old blender, and then you need to get some DNA from a dog and from a cat and from horses and from camelids. And this is probably the most important one, as I usually like to say, the alien DNA. Greyhounds actually never do what other dogs are supposed to be doing. So you mix all that and you end up with this beautiful galgo that we have here in this picture. And, now there's a lot of info on genetics. As I said, I'm going to share it with you in a second, but we know these dogs have been around for 6,000 or 7,000 years. And in that period of time, they had evolved to be what they are, that are basically race cars with really good eyesight. And depending upon who you talk to, there's, some people include some of these breeds within the sighthounds, other people do not. And, a lot of people go, what do you mean a Rhodesian Ridgeback is a sighthound? Well, it is considered to be a sighthound. And we work with a few of these breeds. We spend a lot of time in Spain working with galgos, a lot of time at OSU working with greyhounds. We did a little bit of Irish Wolfhound stuff, and now we're working with the folks at Cornell trying to establish reference ranges for Irish Wolfhounds, and we did quite a bit of work with Deerhounds. So we're still working a little bit with the folks at Washington State with the bleeding gene in the Deerhound. So this is a hallmark paper going back 14 years now from Elaine Ostrander's group. And Elaine is a vet who is the guru of canine genetics. And in those days, 15, 14 years ago, they were trying to figure out, okay, so how did dogs branch out from the wolf? We know they come out from the Middle Eastern wolf, and you end up with this little wheel of fortune here with all the different breeds. And if you look at the upper right, left-hand corner, here we have what we call the ancient and Spitz breeds, and those are, interestingly enough, where the African and the Saluki are. And you go, well, how come the sighthounds live down here when they are so closely or seemingly so closely related to the ancient breeds? And now we know since 2010, there's been a lot of papers that show that there's a lot of little arrows going back and forth between these two groups. So we know that they are indeed closely related. And this is a really nice paper that just came out of China only a few months ago. And what they did is they look at a large number of sighthounds, and what they found is that most of the sighthounds had, for lack of a better term, DNA enriched with these two particular genes, ESR, estrogen receptor 1 gene, and JAK2. And those are genes that are basically primarily driving blood cell formation, cardiovascular function. Adrenergic receptors, remember, most of you know about adrenaline that we release when we are scared or frightened, and adrenaline and a lot of the other adrenergic mediators are part of how the heart, for example, and the muscle work. And then a lot of his genes are involved in muscle repair, which is really, really cool because this is exactly what this dog had been doing for the last 7,000 years or so. And you can see greyhound looking dogs in some of these paintings that date back to 6500 BC. So we know that they have been around for quite a while. And in that period of time, they have developed a lot of adaptations that have resulted in them being quite different from other dogs. Now, I always say, ideally, this will be the typical greyhound because you would like this greyhound that has 8 legs. Actually, there are 2 greyhounds side by side in the first turn. This is in the wheeling racetrack. And again, these guys have evolved over a long period of time for racing. This still is going on in some countries quite a bit, and a lot less here in the US. And these are all galgos, or they look like galgos. And this is at Scooby Medina. And like I said, when you look at these dogs, they are actually a Formula One race car. They were developed to be really, really fast, and that led to a number of adaptations. And that's what I want to do. I want to chat a little bit about that and how those adaptations lead unexperienced veterinarians to make wrong assumptions and quite often spend a lot of money in diagnostics. So if you look at what we know about greyhound health now, it's a lot more than when I started in the early 90s. And in those days, there was no science. Actually, if you tried to pull a paper on internal medicine in greyhounds, there were none. So we generated about 90% of the papers on internal medicine in sighthounds ever since. And most of it was lore, word of mouth, oh, well, in my experience, blah, 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 blah. And there was a lot of stuff written about orthopedic issues in greyhounds, of course, but literally nothing on internal medicine. So I used to tell the students, and I still do to this day, if you think a greyhound is a dog, when you're examining him or her as a patient, you messed it up, all right? Because greyhounds are not like any other dogs, as probably all of you know, and that's why you're attending this webinar. So today I want to talk about what I scientifically call greyhound things, all right? So kind of physiologic adaptations that actually look like diseases in other dogs. And as I was telling you before, we will do a webinar later on in the year talking about, they're not greyhound specific diseases, but they are common diseases in greyhounds. We'll talk a little bit about bone cancer. We'll talk about bleeding. We'll talk about SLO. We'll talk a little bit about corns and what's going on. And again, there's a lot of dog diseases that, of course, affect greyhounds because they are kind of dogs, but quite often they have different manifestations that you would expect to see in other breeds. So today, the focus is going to be on this quote unquote greyhound things, all right? And I figured that one of the ways to do that is to present a case. And again, I'm going to explain a lot of the technical or medical terms in hopefully language that everybody can understand. So let's say you adopt this dude. Skinny is a 4-year-old male castrated retired racing greyhound, goes out in the yard and does a lot of zoomies, and then goes back, sits on the couch and pants for half an hour, and you're going, you know what, I'm a concerned mom or dad, so I'm going to take him to the vet right away because I'm really worried about it. And the reason for that is because you go, you know, I'm thinking this dog is an athlete. Why should he be panting and this and that and so on and so forth? So your vet does a physical exam, and I know there's a lot of vets in the group. I was just looking at the names, and a lot of people who've known each other for a long, long time. So BAR, for people who are not in the vet arena, means bright, alert, and responsive. And, you know, we use a lot of abbreviations, as you know. He's restless. He has a heart rate of 180. Remember, typical quiet greyhound has a heart rate of 60 to 80, give or take. So his heart rate is fast. That's what we call tachycardia. He has bilaterally dilated pupils, and that's what we call bilateral mydriasis. And he has a murmur on the left side in the base of the heart. And I'm going to tell you a little bit what that means. So now we're going to do an assessment. And the question is, for those of you who don't know, what is a heart murmur? So a heart murmur is an abnormal heart sound that is usually associated with turbulent blood flow. So if you think about how the blood flows through the heart and the blood vessels, it should be kind of like a quiet stream, as you see here. When you have blood that is gushing through, as you see here in these rapids, you obviously have turbulence or turbulent blood flow. You have blood swirling around, and that generates an abnormal sound that we call a murmur. And depending upon where it is located in the heart, it means different things depending upon the duration, the location, the heart cycle. You know, we grade these murmurs 1 to 6 scale, and as you will see in a second, we do tend to hear murmurs in greyhounds quite often, that most of you actually know that. So we go back to Skinny, and he's bright and responsive, restless, tachycardic. He has both dilated pupil, and he has a 2 out of 6 left-sided basilar systolic murmur. What that means, basilar, it means that it's in the base of the heart. I'm going to point that out to you in a couple of slides here. And the question is, what does all this mean to me as Skinny's mom or dad, right? But first, before we do that, I want to tell you a couple of things about the greyhound spleen. So this is a dog that came to the clinic with the name of Edie and left being called Eddie. It was actually a hermaphrodite greyhound, which was interesting, one of only 2 I've ever seen. So when you look at a greyhound and you do a CT scan or an ultrasound, this happens to be the liver, and this happens to be the spleen. And the spleen is an organ of the blood forming system that has a variety of different functions that we're not going to discuss today, but primarily is in charge of eating bad things that circulate in the blood and making some blood cells. And I'll tell you in a minute. So if you look at an X-ray, this happens to be the spleen in a greyhound, and this happens to be the size of a spleen in a non-greyhound dog. So basically, anytime a greyhound gets an abdominal X-ray, the veterinarian will go, oh my God, they have a really big spleen. And of course, we go, yeah, right, because they're greyhounds. And you have no idea, you guys, in the old days, how many of these greyhounds had their spleens removed surgically because they were big, all right, and nobody knew what was going on. Now, I'll tell you a little bit about why the spleen is big. So for the vets and vet students in the area, when you ultrasound a greyhound, you know, this is the spleen, and this is actually the right kidney. So, you know, the spleen is on the left side for the non-vets in the group, and there shouldn't be spleen on the right side, but the spleen wraps all around. I'll show you this picture. It's a CT scan of a greyhound with an osteosarcoma, just to show you a normal spleen that looks like a shark, kind of, but the spleen wraps all around. So they have these really, really huge spleens. And you go, well, wait a minute. If this is a Formula One car, why would I want extra weight in my Formula One car? So this big spleen must be of some benefit to them, and we'll talk about this in the next few slides. So again, you know, there's, depending upon where these dogs race, if you're in the UK, in Australia, in the US, the length of the races are a little bit different. But you know, remember, greyhounds are sprinters. You know, when you look at galgos, the galgos are more like marathon runners, but the greyhounds are sprinters. So So we did a number of studies with Lori Bohenko's team at the Wheeling racetrack, and this is one of the studies. And here we're collecting blood from a lot of greyhounds. We bled, I can't remember, 150 greyhounds and before the race, and then we went and we bled them immediately after the race, and then a little bit later, and just to look at a variety of different parameters that I'm going to share with you here in a second. And we knew a few of these things, but we were very interested in some of the other ones that had not yet been worked out. So we look at this, we published this with Steve Horvath, who is a vet that practices in Columbus now. And this was a study sponsored by IDEXX, and reticulocytes are baby red blood cells. So they are made in the bone marrow, they circulate for 2 days, they park themselves in the spleen for a few hours. And then when they come out of the spleen, they are mature reticulocytes. So we knew that when greyhounds race, literally within seconds of leaving the gate, this is their red cell count or hematocrit, that red cell count goes up big time. And the reason it goes up is because the spleen stores a lot of red blood cells. So these red blood cells will actually appear in the blood all of a sudden. The spleen squeezes what we call a bolus of red blood cells, and they will appear in the blood. And as you can see, within about an hour of the race, 60 to 90 minutes after the race, the red cell count goes back to normal. And we had noticed that a lot of scared greyhounds have high reticulocyte counts in the blood. And this is exactly what we found. And what we found is that the spleen stores, as I was telling you before, not only red blood cells, but also reticulocytes. So when they contract that spleen immediately during the race, they release a lot of these reticulocytes in peripheral blood. For vets, this is an issue when they have a scared greyhound and they run a blood count and they see a high reticulocyte number and they don't know what to do with it. But now pretty much everybody knows that adrenaline or catecholamine release will result in a high number of reticulocytes in the blood. Now, most people go, what is this? What is CP? So the blood viscosity, just to give an idea, CP stands for centipoise, and the viscosity of water is 1 centipoise, all right? And the viscosity of blood before a race in a greyhound is about 2.9, all right? And look at what happens immediately after they shoot out of the gate. The viscosity of the blood doubles, all right? So think about this. So I'm not going to tell you it's motor oil, but it is, probably close to that density. I think motor oil is 10 centipoise, give or take. So again, you go, wait a minute, this is really a very thick blood. Why do they need that thick blood? As you will see in a second, they need it because thick blood actually causes dilation of the blood vessels in the muscle, and that will actually increase oxygenation of the muscle and the heart muscle. And again, this is something that we didn't know at the time. But the big issue is, how do these greyhounds pump that blood that is so thick? And the explanation is they have a really, really voluminous heart that works very, very different from other dogs, all right? And the left side of a heart, what we call the left ventricle, that would be up here, is what shoots blood to the body, all right? So the right side shoots blood to the lungs, but the left side shoots blood to the body. So if we go back to Skinny, he is restless, has a high heart rate, he has bilaterally dilated pupils and a murmur. What would your vets think? Well, he has a murmur. Why do we see a murmur? I just want to show you this quick. This is an echocardiogram. This is the left side of the heart. This is the left ventricle. This is the left atrium, and this is what we call the mitral valve. And this is the galgo. The galgo and the greyhounds have the same physiology. And I'll show you this video next to a normal dog to show you how different the heart function is. But the important thing is that because they have so much more blood on the left side, the only way they can get that blood out is by shooting it out of the heart really, really fast. And this little orange triangle or red triangle that you see here is the velocity or the speed of the blood going through the aortic valve. This is a normal dog, and this is a galgo, normal galgo. And what you can see is that in a normal dog, the blood comes out of a heart at a speed of 1 meter per second, whereas in a galgo, the blood comes out at about 2 meters per second, all right? So that blood that is coming out of the heart at such a high velocity or speed is the one that is swirling and is accounting for that murmur that we hear in so many of the greyhounds. So what you have is you have this turbulent blood flow going through the aortic valve, and that is absolutely normal. So if you're listening, particularly with a velvet stethoscope, this is a low frequency murmur, so you will hear it very, very well. And years ago, we did this study and we showed that basically 2/3 of normal greyhounds have a heart murmur. There's papers on whippets, Italian greyhounds, Slawis, Salukis, etc., and most of them have a left basilar systolic murmur. So we go back to Skinny, and he has a big heart, and they did a quick echocardiogram, and I'm going to show you a little bit about this funky contractility, because the heart in the greyhounds and the sighthounds contracts like this, basically, as opposed to milking blood from the bottom to the top as it does in other dogs. And I'm going to show you that in an echocardiogram here in a second. So they will check his blood pressure, and his blood pressure is 180, and we know that normal dogs should have blood pressure, systolic blood pressure, in the range of normal people. So this is the range for dogs, and this happens to be a group of blood donor greyhounds when they came to donate blood in the hospital. So the question is, we know they have a high blood pressure. They don't seem to have any of the target organ lesions that we see in people with high blood pressure. So is this high blood pressure a 24/7 deal or not? And the answer is, in this study that we actually did, with Christina Marino was at the time one of our students. She's now a boarded internist. And what we did is we then went to the home of this family and we checked the blood pressure. Then we trained the owner on how to check the blood pressure at home by themselves. And what you can see is rather obvious. In the clinic, their blood pressure is high, but at home, regardless of whether the student or the owner checks their pressure, is within the reference range. So the answer is, yeah, they do not have high blood pressure 24/7, only when their catecholamines or adrenaline kicks in. And we published this paper where we basically look at what we call white coat hypertension, and this is something that we know is a common situation in greyhounds. We have seen greyhounds in the clinic. They have blood pressures that are technically not compatible with life, and then they go back in the car and they're back to normal within minutes. So again, you're already sensing where we're going with this. So, right. So he tires easily, he pants, he has a murmur, he has a high blood pressure. So we're going to take radiographs. All right. And needless to say, as I told you before, this is a lateral thoracic radiograph. This is the heart right here. This black pipe is the trachea. This white pipe is the aorta. And I'm just showing you a greyhound. Lily Marine was a main author of this study that we did. And boxers are one of the breeds that tends to have bigger hearts, compared to other dog breeds. And we do this thing that we call the vertebral heart score that should be under 10, 10.5 in most dogs. And as you can see, it's normal in this boxer, and in this greyhound is quote unquote high, but we know that greyhounds have a higher vertebral heart score. So, now there are a lot of built-in softwares for digital radiographs that will automatically calculate the vertebral heart score. So you will get a report that says that your greyhound has a big heart. And we know that the question I always ask is, big heart for a greyhound or big heart for a dog? And your vets should be aware of that. So we published this, and again, I think that contributed quite a bit to understanding what is going on with the greyhounds. And as I was telling you, if you do have a patient that has a big heart, you may send him to a cardiologist, or you may do a quick peek echocardiography just to see what is going on. And this is a Dalmatian dog, but what I want to show you is the greyhounds actually contract their heart like this. Like basically, it's like if they are clapping. So when you actually do an echocardiogram, the values are totally different for normal dogs. So we have reference intervals for a lot of sighthound breeds. And B, the contractility looks abnormal. So if vets are not aware of that, they will say, well, your dog has cardiomyopathy. That is a disturbance of the myocardium or cardiac muscle function. So So again, you see how this is piling up, all right? So does my dog have a cardiomyopathy or not? Well, I'm going to measure the troponin. That is a molecule that comes out of the heart when you have myocardial damage. And as you all suspect, these are boxers with cardiomyopathy, and the ranges are very similar to greyhounds. And, what you see in gray happens to be the reference interval for dogs, right? So these are the non-greyhounds in our control study. And, Ryan Baumgart was one of our cardiology residents. He's now a cardiologist at Washington State. And again, if you run cardiac troponin in greyhounds, they are high, right? So, and this is resting greyhounds where they will have values that are higher than in boxers with cardiomyopathy. So as new cardiac markers come out, people like to look at them and, we'll have about troponin. Troponin is a marker of diastolic dysfunction, and proBNP is a marker of diastolic dysfunction. And when that test came about, we started looking at greyhounds. And remember, my rule of thumb is that when I run a new test in a greyhound, my expectation is that the results will be outside the reference range for dogs. And look at that, so when we did proBNP in greyhounds, these values over 1,500 are usually, or over 1,200, are usually associated with patients that have pretty severe heart disease. So what happens as a consequence of all this? There are a lot of greyhounds diagnosed with heart disease. And I tell you, heart disease in greyhounds, in my experience, is very, very uncommon. But when you add the clinical signs, the murmur, the big heart, the contractility issues, the high blood pressure, troponin, the proBNP, there are a lot of greyhounds taking drugs for heart disease out there. And most of them likely are normal greyhounds. So again, all these things have to be taken into consideration. So I use the cardiovascular system as an example. I could have used a bunch of other things, but I think this sort of brings the point. So the next 20 minutes, I'm going to talk a little bit about lab work, what we call clinical pathology. So when your vets draw blood from your dog and they do what we call a minimum database. A minimum database is a blood count, chemistry profile, and a urinalysis. And some people also add tests for tick-borne diseases in the minimum database. So this is something your vets will run either on a wellness visit or they will run when your patient is not doing well. So it's always good to have a minimum database run on your dog when they are healthy, because then you know what the values are for him or for her. So you have your own control in there, which is very, very, very helpful. Blood counts, this happens to be a report from a dog, and we have a bunch of numerical values and we have some graphics. And again, most vets will look at the values and they will not look at the graphics, which is a big mistake. The graphics give you way more information than the numbers, but not everybody is trained to do that. And I'm not going to, the gist of this is not for you to look at the numbers, but just to tell you, we look at red blood cells. All these are red blood cell parameters. All these are white blood cell parameters, and all these are platelet parameters. And this happens to be a normal greyhound. Yeah. So if you have a normal greyhound and all the values are in the normal range, then there is something wrong with your dog, all right? Because we know that most greyhounds will have higher red cell counts, they will have lower platelets, they will have lower white cell counts, lower neutrophils, et cetera, et cetera. So I'm just going to give you a little flavor for what we need to be looking at. So again, in a normal greyhound, most values will be within the greyhound reference interval, but not within the dog reference interval. If, for example, your vet uses IDEXX laboratories and they identify your dog as a greyhound and you live in the United States, the reference values that will be provided here that people think are the normal range, although that's a little bit different the way we interpret it, IDEXX will provide a greyhound reference interval. So just to give you some idea, a lot of you have those little cards that the Greyhound Health Initiative puts out that has reference intervals for different analytes in greyhounds, and red cell counts are high, white cells are low, platelets are low, protein is low, creatinine and CMA are high, lots of different things, all right? But just to show you guys, this is just, on the left, values that are expected to be lower in greyhounds than in other dogs, and on the right, values that are expected to be higher than in other dogs. So there's a lot of stuff going on. And as I was telling you before, do not look at dog reference intervals or normal values when you're interpreting your own dogs or your greyhound patients' lab report. So again, I'm not going to bother you with this. I'll just skip through this real quick. But hematocrit is the red cell mass, or what proportion of the blood is composed by red cells. And in normal dogs, they go all the way up to mid 50s. All right. If a greyhound has a hematocrit below 50, they are anemic, right? But look at what happened. A normal dog will be diagnosed with a low hematocrit when they are below 35 or 37, all right? So in this window between 50-something and 30-something, your greyhound is anemic, but your vets may not know about it, all right? And again, super important for them to know that, because then they can catch anemia or a low red cell count a lot earlier. Neutrophils are one of the 5 types of white blood cells that actually eat bacteria and a number of other things. And if you look at the reference interval, it's this blue box, and the greyhounds are at the low end of the reference interval, and some of them are actually below the reference interval. This may be an issue, particularly if you have a greyhound with osteosarcoma or any other cancer, and your patient is undergoing chemotherapy. And for osteosarcoma, we usually use carboplatin. The brand name is paraplatin. And what actually happens is, remember, we look at the neutrophil count to decide whether your patient can take another dose of chemotherapy. And a lot of the greyhounds will have a quote unquote low neutrophil count, so the chemotherapy will be delayed because their white count is really, really low. What does that mean? That means that over a prescribed period of time, the patient or your own dog will get a significantly lower dose of chemotherapy, and that is called dose intensity. And dose intensity has been correlated with prognosis. So if you have a patient that has a lower dose intensity, in other words, get less chemotherapy over a prescribed amount of time, probabilistically, they will not live as long as the ones who got the full dose intensity. So important issue when we're looking at chemotherapy patients. So, and again, platelets, remember, they tend to be low. The platelets are these little cells that help blood clotting. They're the ones that initiate the clotting cascade. And most of the greyhounds will have lower platelet numbers because their platelets actually stick together when you put them in the tube. And quite often, after 6 or 7 or 8 hours, they will start coming off this little clump. So if you send that sample to a reference lab, you may get a slightly higher platelet number than with your in-house analyzer. And these are actually in-house analyzer data. So just to give an idea, lots of different things. Christina is in the audience. I just saw your name. Hi, Christina. And Christina was the main author in this paper. We had actually gotten a greyhound by the name of Star, who was a black and white 3-year-old that was coming in as a prospective blood donor. And the lab tells us that they think that she may have an infection because she has abnormal white cells in the blood that look like this. And these abnormal white cells are actually normal in greyhounds. They're called eosinophils. They are cells that are involved in allergic reactions, immunity against parasites, and a number of other things. And in normal non-greyhound dogs, they have these orange or pink granules, and in greyhounds, those granules are empty, so they look like beat up neutrophils or young neutrophils that are facing infection. So again, yet another greyhound thing, and a lot of the analyzers will not recognize them as eosinophils. And funny enough, if you look at eosinophils in galgos, they look just like a normal dog eosinophil, but in the greyhounds, they look like they've been shot. They have a bunch of little holes all over the place. So something to keep in mind when you're looking at blood smears. Christina also was the main author in this paper where we look at blood groups in greyhounds. The 1-1 negative is sort of equivalent to the human universal donor. And as you can see, most of the greyhounds are sort of a universal donor compared with a mix of other breeds where only 40% of them are so, and that is not true for other sighthounds. And if you can see, yes, the racers in the US, most are quote unquote universal donors. Same for the UK. The galgos are 50-50, and the deerhounds are the exact opposite. All right. So most of the deerhounds are actually 1-1 positive. So not all greyhounds, not all sighthounds were created equal, as most of you know. So the other thing I was going to show you here is most of you who are not vets will not know what the heck all these things mean, but this is something I just want to show you. When you look, I played a joke on our interns a couple of years, and I told them this was actually from a patient. This is actually blood work from a greyhound immediately after a race. So look at the heart rate, 245, should be 60 to 80. The respiratory rate, 136. Their temperature is high. This is like 103, something like that. Of course, the hematocrit or PCV is high, but the blood pH, that as you will see in a minute, is usually in the range of 7.38 to 7.42, is actually really, really low. And the lactate, I will show you, lactate is a byproduct of muscle metabolism. And this is actually an indication that there is really poor, poor blood perfusion. And the bicarbonate, I'll show you the normals here in a second, but when we see a bicarbonate below 12 or 13, we start cringing. And when we see a pH of below 7.2, we really freak out because we know that this patient is going to be in really deep trouble before too long. But again, these are values that are seemingly incompatible with life. And let me show you, lactate in a normal dog, it's about 1, all right? But let me show you this graph. So this is from a paper looking at dogs with gastric torsion, the flip of the stomach out of pen. And when you look at the lactate, dogs that had lactates of over 7, all right, were not likely to survive. And if you look at this particular greyhound at the end of the race, had a lactate of 28, all right, and within an hour they're back to normal. So how do they do that? Again, this is the blood pH immediately after a race in the same study we did at Wheeling. And again, this in an ICU patient will freak us out. Anything under 7.3, we're going, man, this patient is going to be in trouble before too long. So we need to figure out, because if we can figure out how do they neutralize that low, pH, that, remember, low pH means that the blood is really acid, and that's usually an indication of severe general disaster, for lack of a better term. If we could figure it out, then we could treat a lot of patients in intensive care by using whatever it is that greyhounds use to neutralize that. So we look at a lot of different things, and the hemoglobin is the pigment that carries oxygen in the blood. And I'm not going to give the non-vets a hemoglobin lecture, but we did a lot of stuff looking at hemoglobin in greyhounds and in galgos, and we did a bunch of different things. But what we learned working with Andre Palmer, Andre is a chemist at Ohio State, and he's basically, for lack of a better term, a hemoglobinologist. He just works on hemoglobin, and we learned that the hemoglobin in greyhound offloads oxygen 4 times better than in human hemoglobin. And we know that the hemoglobin in the greyhound has the ability to buffer or neutralize acid in the blood very, very rapidly. So interesting, because one of the things that we were discussing when we got all that information, Sarah Saldivar was the principal investigator for all those studies, was, well, so then giving red cells from a greyhound to a critically ill patient is probably a good idea, because it will actually influence how their metabolism gets reset. So just, again, I'm giving you like little pearls of wisdom. And I'm going to finish up with 2 things. I'm going to finish up with kidney, and I'm going to finish up with thyroid, because those are 2 of my favorite topics. But we know that since I've been doing greyhound medicine, I get consults. I have a happy greyhound that is in kidney failure, all right? And we go, well, if he's happy, he's not in kidney failure. So a long time ago with Bill Feeman, who is now a general practice vet in Medina, Ohio, and he used to work in the blood bank with me. We did this study where we look at creatinine, that is a marker of kidney function, and we published this a long time ago, 21 years ago. And as you can see, the creatinine levels in greyhounds are very, very high. compared to non-greyhounds? Well, what we propose is that because the creatinine comes from muscle, because greyhounds are heavily muscled, quite likely that is why the creatinine concentration was higher. The reviewers of the paper had a bunch of comments, so we addressed all those things. We did a bunch of additional studies, where we look at kidney function specifically and a number of other parameters, and we show that the kidney function in greyhounds is actually, if anything, a little better than in a non-greyhound dog, so it is not due to kidney function issues. But again, as I was telling you before, not all sighthound breeds were created equal, and I'll show you here creatinines in the next slide. But Dr. Rikova, who I had a pleasure of lecturing with a few years ago, looked at a bunch of different sighthounds, and as you can see, hemoglobin is a marker of red cell mass, but you can see the Italian greyhounds have lower red cell mass than the Salukis, right? And again, the greyhounds and the Azawaks are above the reference interval. The greyhounds have lower white counts, but the Borzois have normal white counts. The greyhounds have low platelet numbers, but the Azawaks have normal platelets, and so forth, all right? And this is just to show you the creatinine. Most of the other greyhound or sighthound breeds, excuse me, have reference intervals within the gray, that is the reference interval for the dog, and it's only the greyhounds that have a higher creatinine. The same for ALT, that is the liver enzyme. So again, just to show you that there is some variation among the sighthound breeds. But this SDMA, that stands for symmetric dimethylarginine, is a relatively new marker of kidney disease. And what it actually will do is it will detect kidney dysfunction months or even years before the creatinine goes up. And the creatinine used to be our marker per excellence of kidney function. So since SDMA came into the arena, we can now, in both dogs and cats, detect kidney failure a lot earlier, intervene, and change the outcome and improve the quality of life. So again, typically we see increases in the creatinine or the urea when there is more than 75% of the functional units of the kidney that are lost, but we see increases in the SDMA with only about 40% of loss of function in the kidney. So it's really, really a good marker of acute kidney dysfunction. So this test came out in June of 2015 by IDEXX, and this is the email I get. Here are 3 samples of the new IDEXX test result with added SDMA testing. They are inaccurately reporting every one of our new greyhounds, some as young as 18 months old, with some level of kidney disease or probably kidney disease. I cannot put this blood test out to the adopters without causing a big time problems with them, thinking we are adopting out sick dogs. So not surprisingly, again, as I was telling you before, when a new test comes along, I always assume that the greyhounds are going to be different. And this is just to show you the flow chart, what IDEXX recommended you do when a dog has a high SDMA, and this is mega bucks, right? By the time you're done, you spend over $1,000 in diagnostics. So they would say, well, we need to look at these things, and sure, for up to 14 is normal. This happens to be a totally normal greyhound with an SDMA of 19, and again, the SDMA is increased, so your dog has kidney disease, blah 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 blah. So we actually did a study with IDEXX, and what we showed is that the reference interval for greyhounds goes up to 20. All right. So again, we did greyhounds, we did both pups and adults, and the reference intervals are the same. So the important thing for your vets to know is that SDMAs below 20 are absolutely normal in greyhounds, whereas in normal dogs, they would be abnormal if they are above 14 micrograms per DL. So just to finish with that, so we published this paper, and I'm not going to bother you with that, so I'll skip through it, and we'll finish up on time with the thyroid that everybody asks about thyroid, right? So remember, in the US, when we did our study of health issues, and we did a questionnaire to survey the different health issues in greyhounds, we found out that a high proportion of greyhounds, quote unquote, had hypothyroidism or low thyroid function. So remember, the thyroid glands live around the neck, just below the voice box, and there is this portion of the brain that is called a hypothalamus that makes a mediator that's called TRH, and that tells the pituitary gland that lives right above your palate in the base of the brain that it has to make TSH, and this TSH is the hormone that actually stimulates the thyroid gland to make thyroid hormones. And they are what we call T3 and T4. And then we also have free T3 and free T4. So if you actually look at our internal medicine book, this is the clinical manifestations of hypothyroidism in an adult dog. Lethargy, mental dullness, don't tell that to the greyhounds. Inactivity, have you ever seen a greyhound that sleeps 21 hours a day? Never, all right? Symmetric or asymmetric alopecia, like both eyes. You go, have you ever seen that in a greyhound? Of course, all right? Either low heart rate, 60 at rest, or arrhythmias when they are freaked out. Coagulopathies, the greyhounds bleed, of course. Behavior abnormalities, separation anxiety, attachment issues, and so on and so forth. You look at all this and you go, oh my God, all these greyhounds have low thyroid function, so we better test them. So this is probably the best paper from Dr. Shield in Ireland, looking at this is total T4, and this is free T4. What you see in the blue square are the reference intervals for dogs, all right? And remember, different parts of the world use different units, all right? So this is European, what we call SI units. But look at this, there are only 4 greyhounds with T4s within the reference interval. Most every other greyhound is actually below the limit of detection for the assay. So for the US, that will be below 0.1. That is the micrograms per day limit of detection of most commercially available assays. And the free T4, that is supposed to be a really good marker of thyroid function, even though most are within the reference interval, as you can see, they are all in the low end of the reference interval. So as I was telling you before, the pituitary gland actually makes this TSH that keeps the thyroid functioning, all right? So if you have low thyroid levels in the blood, and those low thyroid levels are, for lack of a better term, real, all right? You have a golden with hypothyroidism, what will the pituitary gland do? It will secrete a lot more TSH because it's trying to wake up the thyroid gland and tell it, hey, you need to make more thyroid hormones, all right? So most hypothyroid dogs will have low T4 and or free T4, and they will have a very high TSH. But look at what happens when you look at the greyhounds, all right? Except for this dude or dudette in here, most every greyhound is below 0.2. That is a very, very low TSH. So this likely means that low thyroid function is normal for a greyhound. We're still trying to figure it out. Dr. Shield just published a really nice paper looking at genetics. They look for different markers of low thyroid function, and they couldn't find any. So it's interesting because all these greyhounds with low thyroid function, every other aspect you look at is like in a dog with normal thyroid function. So what we conclude is that level of T4 and free T4 must be normal for a greyhound. When you do thyroid scans, the greyhound thyroids light up, so everything is good. So they do not have hypothyroidism. And if you look at whippets, same deal. The whippets have lower T4, free T4, and they have low level TSH, and the same for Slowies and, everything. Now, if you had continued reading in our book and gone to the next table, you would have read this, that sighthounds, like greyhounds and some Nordic breeds and other breeds, tend to have T4 and free T4 lower than normal, but the TSH is no different. In actuality, in some of the studies, the TSH is lower. So as a consequence of this, they are tens of thousands of greyhounds that are receiving thyroid supplementation, all right? And the only way you can accurately diagnose hypothyroidism in greyhounds is if you measure T4, free T4, and TSH. You cannot diagnose hypothyroidism with only a T4 or a free T4 in a greyhound. So why is this an issue? Because you guys remember, thyroid hormones increase myocardial or heart muscle function. And here you have a heart that is working as hard as it can work, and now you're going to throw additional issues to the cardiac function. So to finish up, I promised we would finish on the dot, and it's 59 after, so we will be done on the dot. So greyhounds do look like dogs, but I think it's a trick, right? Somebody played a trick on us to make us believe that these dudes are actually dogs, but they are not. And there are plenty of reference intervals for greyhounds. If you go onto the GHI website, we have reference intervals for most analyzed. Remember, every analyzer is different, every lab is different. So you have to compare them to the reference intervals for your lab. If you don't know about lab work, if you don't know about cardiac issues, if you don't know, for example, about corns, you guys have no idea. I just did a consult not too long ago in Southern California, what I call the $10,000 corn dog, a greyhound that had a corn in the rear leg, and they were actually ready to amputate the leg because they had diagnosed him with a spinal issue that was not going to be repairable. And of course, we dealt with the corn and he went back to normal. So if you don't know all that, that has a lot of not only clinical, but also emotional implications. So I think that with that, I'm going to stop sharing my screen and hopefully I can see the Q&A, or Joe can read the questions and we'll take it from there.
Thank you so much, Guillermo, and thank you everyone who's posted questions as well whilst he's been talking. Yes, we do have a few questions. I'm thinking what might be easiest is if actually, because some of them are quite involved, I might actually send them to you in the chat function, if that's okay, so that you can read them out.
I tell you, I could actually finally, now that I stopped screening the sharing the screen, I can actually read the Q&A. So, and looks like there's
the first question, if it helps to get you going, is from Cindy, and she's asking if borzoi have similar issues to greyhounds when it comes to health.
Repeat that, because I couldn't hear. If what has similar issues?
Borzoi.
Yeah, I tell you, I found it here, Cindy. Yeah. Hi, Cindy. How are you? So I have not worked personally with a lot of borzois. I know that they have some similar issues as far as cardiovascular status go, but I also know that borzois have a high prevalence of cardiomyopathy. So I don't know. To be honest, I suspect if you look at that paper that Ivana Orikova published, the biggest drawback of that particular article is that they had only a handful of dogs from each breed. And remember, when we establish reference intervals, we really want to have at least 120 to 130 normal healthy dogs to establish reference intervals because of statistics. Basically you need a large population, but I do not know. And again, we don't have, to be honest, yesterday I did a PubMed. PubMed is the warehouse of scientific publications. So I did a search for PubMed, looking at every breed of sighthound to see if there was anything new and exciting out there. And the only recent borzoi stuff I have found has to do with cardiac issues, but I think that there is a need for that, and this is why we're now trying to establish reference intervals with Ann Fletcher at Cornell for Irish Wolfhounds, because we don't have any. So I think there is a push in the veterinary clinical pathology world to establish reference intervals for different dog breeds, and that will drive the veterinary students nuts, because now you will have to have a little table for every dog breed that you see. So I think that the bottom line is we need more data. I can see Heidi's question. If we continue with that. Hi, Heidi. How do you determine whether a greyhound sighthound truly has a heart murmur indicative of heart failure? Is the pro-BNP diagnostic tool reliable? So the pro-BNP is not, because as I was saying, the pro-BNP tends to be high in most normal greyhounds. And I have to tell you, first of all, other than the legume-based diets that we were dealing with the last few years here, I have not seen greyhounds with cardiomyopathy. This would be North American greyhound. So the prevalence or the probability of cardiomyopathy is really, really low. I think that a diagnosis comes, as I used to tell the students, it's extremely uncommon for me to diagnose a disease based on a single test result, all right? So you need to integrate everything. I think if you are concerned about heart disease, you probably should see a cardiologist, but the rules of thumb are, for me, all right, so is the patient symptomatic or not? Do they have any clinical signs or symptoms that they may have heart disease? Number two, where is the murmur located? If it's a basilar heart murmur, so if it's in the base of the heart, if it is soft, if it is under 2, 1 or 2 out of 6, quite likely those are normal murmurs. But if I hear that murmur in a patient that I had examined weeks or months ago and they did not have a murmur, and now my patient is not feeling well and has a fever, I would start thinking, could that be an infected heart valve, for example? All right. So I think that you need to integrate everything. It's not a one test diagnosis. And I think that now most cardiologists are fully aware of the reference intervals for echocardiography and radiology for greyhounds and for some of the other Sidehound breeds. They're published for Italian greyhounds, for whippets, for deerhounds, and a few other ones. So those are out there. So hopefully that helps. Let's see, Joe. Let's see. I don't know. My questions are kind of like going in the opposite direction. So, oh, I see. So so is the next one coming up Jody's, do you think, Joe?
Yes,
Yeah,
I think
that's
it's
right.
Jody.
Perfect. Awesome.
Yeah,
So
I'm just transferring those across so that you can see
that's
them in
cool.
order, just to help with some of the comments that went into the Q&A.
Good. So my 3-year-old Irish Greyhound coughs and gags very frequently, especially when drinking water, but at times as well. Nothing ever comes up. Vet has failed for swollen lymph nodes and X-ray with negative findings. We were talking about this with Mandy before we logged in, but it's impossible for me to give you options without examining your dog. But I would actually remember in greyhounds, it's very difficult to get a really good oropharyngeal exam without sedation because their nose is yay long. All right. So the first step in my book, all right, is to actually sedate my patient and do a really, really good oropharyngeal exam and see if there's something in there, big tonsils, masses, inflammation, et cetera, et cetera, et cetera. There are a number of other things that could follow, including endoscopy, advanced imaging, and so on and so forth. So the list of things that could do that will be a page long. So I'm not going to be able to help you a lot. So Heidi is asking the progress on managing LARPAR and degenerative myelopathy. So the answer is no, that I know. So we see, as most people know, a lot of greyhounds with laryngeal paralysis and generalized muscle dysfunction, but we do not really have any good ways to manage them because we don't know exactly what the mechanism is. And I don't think Librela is primarily pain comfort type of drug. It inhibits one of the mediators of pain. So I would not have expected for Librela to be effective. So have there been any studies on whether the length of racing career affects the lifespan of a greyhound? Not that I know of, to be honest. There are some recent surveys coming out of Australia and New Zealand where they are primarily trainer-based surveys. So, but I'm not aware of any of them, and I don't even have any thoughts about whether one is worse than the other. But remember, if you think about it, a lot of people think greyhounds are athletes. They've been running and this and that, so they must have a lot of arthritis when they get old. And remember, arthritis in greyhounds is very, very uncommon unless they have had an injury, and that particular injury led to damage in the joint, and there's not just one joint that is inflamed. It's extremely uncommon. So what questions should you ask vets to determine how knowledgeable experienced they are? You mean without the lamp that we use for interrogation and any other deterrents? Most vets are pretty frank. If you ask them, they will tell you. So I don't think you need to use any tricks. There's a lot of vets attending this lecture that know a lot about greyhounds, and there are some vets attending this lecture that want to learn more about greyhounds. And my experience is, at least in the States, most vets are totally open to you pointing them in the right direction. If you go, hey, do you mind checking out the GHI website and look at what's different in the breed? Most veterinarians will be super happy doing that. So Steve, we have an 8-year-old male retired racer, 6 months post-diagnosis of osteo in his right front paw with an amputation, IV chemotherapy, Turgen, and we're not 3 weeks into daily metronome. So in addition, it gets so it's a flavonoids, curcumin, lungs and bones remain visible tumor-free. Is there any additional recommendation you can make for staving off metastasis from this cancer? No, I tell you, there isn't really a ton of new stuff going on. Turgen vaccine may work. We do not have a lot of data from large studies in osteosarc dogs, particularly greyhounds, to see what anything in addition to amputation and chemotherapy brings to the plate. There are some new preliminary studies where some dogs receiving a combination of investigational drugs may live a little bit longer, but what we need data. But you're doing more than the average greyhound family will do for their dog, so that's great. Hopefully everything will work out well. So let's see, Jordina, is possible that ALT of over 500 could be caused by exercise stress, white coat syndrome, perhaps high protein in the food. My female is otherwise behaving normally. Imaging of all girls normal. Full blood work has found high LT. She's currently eating a very low protein diet until the next blood panel. So the answer is no. That's a simple answer. When do we see what level of ALT elevations do we see after a race? For example, if that particular lab has a reference interval that goes up to, let's say, 80, all right, we will see 100 or something like that, all right? So we'll see like 20% elevation, 30% elevations. Is extremely unlikely that exercise will actually be responsible for that. However, ALT, we used to think that it came only out of the liver, and now we do know that ALT comes out of a muscle too. So there are some muscle issues in greyhounds, for example, what we call polymyositis or polymyopathy, that is an immune-mediated disease that affects the muscles. We see infectious diseases such as Neospora that can cause damage to the muscle. The easiest way for your vet to tell whether that ALT is coming out of the liver or out of the muscle is to also run what we call a CK, that stands for creatinine kinase, CK, that's the name of the enzyme. If that ALT is coming out of a muscle, that CK should also be elevated. I have to tell you that we have recognized a few greyhounds that have liver disease that is not yet reported in the literature. It may be related to copper storage in the liver. And in most of those dogs, the ultrasound of the liver is normal. So you actually have to get a liver biopsy in order to decide what is going on. Your vets can do a number of other diagnostics for the liver, and I'm sure they're fully aware of that. Debbie's asking if the numbers apply to AKC greyhounds. The answer is, I don't know. We tried to do an AKC study, but we never got enough samples. Or the other one things mentioned earlier were the major differences between racing greyhounds and AKC greyhounds that, in terms of genetics, we did a study with Carlos Alvarez from Nationwide Children's Hospital. And interestingly enough, when you look at the AKC greyhound genetics, they cluster all together and away from the racing greyhounds. So they look like different dogs. And for example, I have not seen, I'm trying to remember, I think I've seen 3 AKC greyhounds with osteosarcoma, and 2 were actually in flat bones as opposed to long bones, that is where we see most of them in the retired racers. So I know that they are different. That's all I can tell you at this stage of the game, but we really need more info. As the greyhounds age and lose some muscle mass, as the creatinine decrease, that varies from patient to patient, and in some patients it does decrease. So a lot of the softwares from diagnostic labs now, I know IDEX has this really good feature for the vets in the software where you can look at all the lab work together, hit this little arrow, and it will graph out the trends so you can see if they stay up, go down, or they remain the same. So I think it's always good when you have a patient that has significantly decreased muscle mass to also look at SDMA as a marker of kidney disease, as we do in cats with hyperthyroidism. Cats with hyperthyroidism lose a lot of muscle mass, and they are prone to developing kidney disease, but you cannot catch it by looking at creatinine because the muscle mass is so small that they will not have increases in it. So Casey, how about galgos? Are they prone to osteo? The answer is no. We don't see very many galgos with osteo. SLO, I have seen only a couple of galgos with SLO. Corns, I have seen a handful of galgos with SLO, but I do not think that they are as frequent as they are in American former racers. 2 of my greyhounds had lung node tumors when cancers were not thought impossible causes. I tell you, I have probably seen half a dozen primary lung tumors in greyhounds, so extremely uncommon. So do greyhound pups have the same type of hardware as adults? No. Remember, most pups in every breed have different reference intervals, so you need to look at that very differently. Carol, I had a GS with CASPA. Is there better treatment now that are removing all the teeth? That's another area where we do not know a lot. So it's I am not aware of any scientific evidence that will support changing things. So what causes pinhole bleeding from corn issues? Corners, remember, we use the term corners to refer to one disease. When all is said and done, it's going to be a bunch of different diseases. So there's some that bleed, some that don't. There are some that have foreign bodies. There are some that have mineralized materials. So I don't think I could answer that. In my experience, it's not a common occurrence, but it will have to be something particular to your dog, I would think. Hi, Jan. Does a greyhound with one lung have more or less normal lifespan? Had my 7-year-old girl recently had her left lung, both lows removed due to Ebola. To be honest, I haven't seen very many greyhounds with only one lung, but I know in people, the life expectancy is the same if everything goes well and they do not develop Ebola in the other lung. That is always the trick. Muriel, as racing goes away, do you anticipate seeing changes of difference in greyhounds from other dogs? I think it will. I think that as these dogs become, remember, primary criteria for selection has been how fast do they run. So as that becomes a secondary factor or non-factor, I suspect a lot of things are going to change in these dudes. Any thoughts on sudden collapse and death in an otherwise healthy greyhound? The 2 big issues that I have seen, and actually one of them involved my own dog, are hemangiosarcomas that are a very vascular tissue or tumor. And I have seen quite a few hemangiosarcomas in the heart in greyhounds. And the other one is massive cardiac arrhythmias. We see a lot of greyhounds that develop severe, rapid, irregular heart rate and what we call tachyarrhythmias, and that's probably another reason. If we're not talking about anesthesia, but remember that we now know that protracted anesthesias, anything over 90 minutes or a little bit longer, will result in a lot of greyhounds releasing a high amount of potassium from the muscle. And that high potassium level, if gone unattended, will stop the heart eventually. So it will slow down the heart and it will stop the heart. So any greyhound that has to be under anesthesia for a long period of time should have the potassium closely monitoring. There has been a lot of research lately on greyhound bleeders, but there's a little bit of information on the greyhound with the opposite issue who seem to have extra clotting. Yep. Many strokes for which you have often recommended half baby aspirin therapy. I have been able to find a lot of info. Yeah, I tell you, I am aware, Kathy, of only one paper looking at greyhounds with CNS or central nervous system thromboembolism. There was Phil March's paper out of Tufts a number of years ago. There is very little on it, and the research that is going on the DPOE, as they call it, delayed post-operative hemorrhage, that is the term that Michael Court at Washington State coined for the greyhounds and the deerhounds that bleed after surgery. They are now looking at what are the gene expression profiles in dogs that actually have thrombosis. So hopefully we will know a little bit more about that. As much as you know, in your work with galgos, do they also have any issues with anesthesia? Rory, I don't think, to be honest, that greyhounds have any issues with the new currently used anesthetics. I mean, anesthetic deaths are unheard of. You know, just to give an idea, when we were going to the shelter, we would go 3 or 4 times a year. We would probably spay and neuter, I don't know, 60, 70, 80 dogs at a time. We were using, at the beginning, very precarious anesthesias. And in the 10 or 11 years that we were going to Scooby, I think that we have 3 anesthetic-related deaths in galgos. So I don't think it's an issue. In my book, it's not an issue. So Michelle, my greyhound's 5, and she gets bald belly and thighs since I got her age 2. Symptoms for fills in and thickens. She's also she's also difficult to maintain weight, and I have to feed my 63-pound Grey about 4-6 cups of food a day. She got thyroid testing done last summer and came back normal. Yeah, I tell she has separation anxiety. I cannot tell you again. You know, your vets will be able to tell you more about that. We know that the bald thighs and ventral abdomen seem to be a genetic issue in greyhounds. There's been a couple of papers looking at that, and the not being able to put weight, I would need to look at all the laboratory, because remember, when people say it's normal, I always ask, is it normal for dogs or is it normal for greyhounds? Lisa is asking, what is the etiology of bleeders in greyhounds? We believe that is an overactive clot-busting system, what we call hyperfibrinolysis. That is what we had proposed when we did the first study with Anna Lara a long time ago. And now Michael Court's work at Washington State has identified the genes associated with it. And for the greyhound folks in the group, Michael has not yet validated the DPOE gene test in greyhounds. But as of a few weeks ago, when I was chatting with him on the phone, he thinks it will work as well as in the deerhounds. And now, you know, Dan Fletcher is validating it in the wolfhounds. So we'll see how that goes. Has there been any studies in relation to grain-free diet and heart disease? Lots. And the answer is yes, there is a relationship between grain-free diet and dilated cardiomyopathy. What is your recommended dose of Amicar for an 88-pound greyhound who has been determined to be a bleeder via genetic testing? So again, remember, we still don't know that if a dog tests positive in the genetic testing, he or she is going to bleed, all right? But if you need to use Amicar, aminocaproic acid, or tranexamic acid in a greyhound that is over 70 pounds, what we found is that you need to use at least 1 gram 3 times a day. Any pros and cons of coenzyme Q supplementation? Not that I know of. Are greyhounds inclined to have DIC? No. As far as I know. Hi, Linda, by the way. Does there seem to be an increase in splenic issues in greyhounds? You know, splenic issues needs to be defined a little bit further. Most greyhounds, as I was telling you guys before, have a gigantic spleen that may look abnormal on ultrasound, but I am not aware of any pathology associated with splenic issues in older greyhounds. So I would not. I always used to tell the students, don't go doing ultrasounds in healthy patients, because if you find something, now you don't know what to do, and you're going to put the family through a lot of distress. So I personally would not do it in my own dog. Christian, my greyhound's recently diagnosed with osteo in his knee. We're currently using Rivotril and gabapentin for pain control, but would the best step be for pain? You know, again, that depends on your dog and what your vet has found. Tramadol is a drug that we used to use a lot in dogs for pain, and there's now been a number of papers saying that tramadol is not a good drug for pain in dogs. My collective experience is that tramadol is a really good drug for pain in greyhounds, as long as you give them relatively low doses. So I think tramadol is definitely in the book. How does chemo and Grey's differ in their life? I mean, in humans, we make them very sick. So humans wish they weren't doing the treatment. So I always fear putting a greyhound through that experience, as they would not understand why they are so sick. Effectiveness of chemo and osteo. Great question, Pat. So the way we do chemo in veterinary medicine is almost like 180-degree opposite to the way they do it in people. Our goal is not to cure the patient, because we know that if we want to attempt to cure the patient, the price we will have to pay in terms of toxicity is just way too high. We tried doing that in the early 80s, and there is no reasonable human being that will put their dog through any of that. If you look at a greyhound undergoing carboplatin chemotherapy for osteosarcoma, the probability of that greyhound having any quality of life issues will probably be in the 5 to 10% range, maybe even lower than that. It's exceedingly uncommon for a greyhound to get sick while they get chemo. And to be honest, for other tumors, for unknown reasons, greyhounds seem to handle chemo a hell of a lot better than dogs of other breeds for whatever reason. I don't know. Follow-up question, my 3-year-old Geigen greyhound, code for endoscopy and sedation procedure, receives approximate 2,500. She's centrics normal. Would you sedate and have procedure done if this was your dog? Again, I cannot tell you. That's a loaded question because I haven't examined her, so I will have to examine her first. But I think that $2,500 will include endoscopy. What I am talking about is sedation, so you can actually look inside the mouth and you can look in the palate, what we call a laryngoscope. That is a tongue depressor with a light at the end. So that's different things. Our greyhound's data reverse sneezing, is this normal? There's been a lot of papers recently on reverse sneezing, and most of the patients that have reverse sneezing do have underlying pathology. Now, that means most, not all. So I think that is something that your vets have to advise you on. Cheryl is asking about incidence of osteo in galgos, extremely low, very, very low. Non-technical question, hypothetically, what was the outcome with Skinny? It's totally normal, healthy dog. So what is your opinion on CBD? That will have to be defined. I mean, CBD can be used for a number of different things, Irene, but we don't know enough about how greyhounds metabolize CBD. You guys remember greyhound liver metabolizes drugs very, very different from other dogs, and there is some hepatic metabolism for some of the CBD derivatives. So, but I know of a lot of people who use CBD seemingly without any issues. So, have you found genetic markers and if I like those down? No, I'm not aware. There is a paper that just came out of New Zealand where they did a study on ocular pathology in greyhounds, and they look at genes, but I think they did not come up with a consensus. But I do have, actually, I just downloaded the paper like 2 weeks ago. I have it in my to read list. Is IVDD common in greyhounds? Not common. I've seen a few greyhounds, including one of my own. Clyde actually had surgery for 2 discs in the neck, but it's possible. The one other disease you got to be aware of in greyhounds is what we call steroid-responsive meningitis arteritis, or SRMA, or meningoencephalitis of unknown etiology, or MUE. And we see a fair number of particularly young, 2 to 4-year-old, primarily females, although I have seen males, that do develop this syndrome. And it starts with neck pain. A lot of people with meningitis have headaches and neck pain. So that is something to keep an eye on. And Linda is asking, what is the connection between DCM and grain-free diets? There's a lot of papers. To be honest, I don't remember the actual mechanism, but there's been at least a dozen scientific papers, primarily out of Davis and Tufts, looking at the link between grain-free diets and DCMs. If you email me, I can look them up and send them your way. So I think that concludes all the questions. So sounds like most of you guys made it, and that hopefully you remained bright, alert, and responsive throughout, and you learned a couple of new tricks. And again, you will have access to the webinar, to the recording, and you have my email address in the first slide and in the last slide. So if you need anything, feel free to email me. So thanks to Mandy, to Joe, and to everybody else that put this together. And Mandy or Joe, I don't know if you have any other thoughts or comments.
No, I just wanted to thank everybody for coming. Really appreciate it. Really appreciate all of your support and your questions. This was really great. We will post the recording within the next week or so once some of the space is edited out in the beginning there. But if you want to further support us, you can click on the link on the page or the QR code and further support our next webinars. We are going to be having one in April on osteosarcoma. So looking forward to that. And it should be posted on social media and our website here in the next month or two.
Great. Thanks, everybody, and hope you have a great day.